Hello. In this chapter, we're discussing obsessive, compulsive, and related disorders. In this section of the DSM-5, these disorders are characterized by syndromes where symptoms tend to cluster together. Obsessive compulsive disorder describes a picture of obsession and compulsion that leads to significant dysfunctions in a person's life. Other related disorders are distinguished between preoccupation and by repetitive behaviors or mental acts as a response to those preoccupations. Still others are primarily recurrent body focused repetitive behaviors like hair pulling or skin picking. Let's talk about OCD. Well, OCD, people would think that the individual that is normally cleaning all the time, really orderly, or um, just really pays attention to the detail, it's a societal marks them as OCD, right? Well, clinically, from the DSM-5, we're talking about an individual that has severe obsessions or whatnot, and they have compulsive behaviors to actually meet or keep or to try to cope with those obsessions, right? So it's characterized by obsessive, distressing, intrusive thoughts that are related to compulsive actions that attempt to neutralize them. I'll give you an example. Say I had three children in the home and I was afraid that someone was going to kidnap them, right? So to keep my obsessions from to neutralize those exceptions, I would clean to a point where I make sure everything was so tidy or so neat that it was keeping my children safe. They're not going to be kidnapped because of my cleaning and keeping them safe. That's an example of obsessive compulsive disorder, right? So these exceptions and compulsions must be time consuming. They got to take up a lot of time of every day, and they must cause distress or impairment in social, occupational, or school functioning. So the obsessions are distinguished by recurrent or persistent thoughts, impulses or images that are experienced and at some time during the disturbance, and intrusive or inappropriate, and they cause marked anxiety or distress. The person attempts to ignore or suppress those thoughts and impulses or images to neutralize them with some other action or thought. Compulsions are seen as repetitive behaviors or mental acts that a person feels driven to perform in response to the obsession. The behaviors and mental acts are aimed at preventing or reducing stress or preventing some dreaded event or situation. So symptoms of OCD: both sides of the body to feel even, doing everything perfectly so that terrible things will not happen, preventing contamination by repeating or hand washing, specific counting systems or methods of checking, order or symmetry fueled by superstition that requires, for example, aligning objects at perceived right angles, banishing sexual thoughts because sex is perceived as indecent or a lewd act. The person may obsess over whether he or she is genuinely aroused by these thoughts. And specifiers include levels of insight or tick related. Let's talk about body dysmorphic disorder. A central feature of this is a person's preoccupation with an image defect in their body. It includes a preoccupation of imagined deficit or defect in appearance or excessive concern about slight physical anomalies. At one time or another, a repetitive behavior like checking the mirror, excessive grooming, or mental acts comparing how one's look with someone else in response to concerns about their appearance. The preoccupation causes significant distress and impairs several important areas of functioning, like family, social relationships, or at work. And preoccupation is not better explained by concerns with body fat or weight seen in some with an eating disorder. Hoarding disorder, characterized by individuals' persistent difficulty discarding or parting with possessions regardless of their actual value because of perceived need to save them. A person's emotions, thoughts, and behaviors is impacted, impairs social, occupational, or other important areas of a person's life. Additionally, the person may have difficulty managing daily activities because of the procrastination. Let's talk about other obsessive compulsive and related disorders. Trichotillomania disorder involves recurrent pulling out of one's own hair resulting in hair loss. Exoration disorder, recurrent skin picking, most commonly on the arm, face, hands, resulting in skin lesions. Substance or medication-induced obsessive compulsive related disorder, These are due to another medical condition. Both disorder reflect the reality that some medications, substances, or medications can induce symptoms of obsessive compulsive or related disorders. And then we have our other specified and unspecified compulsive related disorders. Use a situation where the symptoms don't meet the full criteria, but there are some obsessive and compulsive related disorder symptoms that cause dysfunction, but they don't meet full criteria.